Hello friends, I'm Dr. Rohit Shetty, represent Narayana Nethralaya. I would like to discuss something very important today about smartphones. Smartphones are one of the greatest inventions of this modern era. It makes you to see the world with a click of a button. With this, I can virtually reach to any dimension I want. I can go to a different universe. All these good things comes at a cost. The cost is with your eyes. So many times I've been asked these questions: how long or how much should I use the smartphones in my clinics, in my practice, in my work, at school? It's a very important question because if you look at it from a very superficial way, this is just light, the pixels here, images here. How does it really affect your eyes? But if you look at it from a misuse, the word misuse is important because the use is always for good. The misuse affects any part of your body. It starts with your eye. It starts with the way we sit. We always have a habit of sleeping and looking at a phone or at any position we want. Look at your muscles, look at your spine. When you sleep and do this, your spine, your back, and every other aspect of your body is not aligned properly. Or that itself is one of the biggest challenges of smartphones, is that we are using phones to watch movies, we're using phones to look at documentaries for more than 1, 2, 3 hours with a posture which you think is very comfortable. We don't do it with TV, we don't do it with computers, but we do it with smartphones. For me, that's one of the biggest challenges, is how your body is trying to adjust to this very poor ergonomic way of watching content with a very poor posture, and that will definitely have an impact on you. That impact on your muscles, on your body, on your posture, everything else. The second thing is coming to what is important from an eye point of view. We all are used to seeing something at this position, and this is how we work, the one arm's length. But let's assume that you are working at different speeds, at a different distance, and you keep changing the position as you wish. If you're sitting in a car, it's at this. If you're reading, it's this. Or if you're watching something, it's this. What happens here is the eye is trying to adjust to the speed of change of the position of your phone. How does it work? The eye optics is driven by the outside, which is your cornea, and the lens. The lens keeps moving in and out every time you move your gadgets at different speeds to and fro. So what happens is that when you're doing it, your muscles is at a constant stress. We don't do it. If I have to read or write something, I keep it at the same speed, at the same distance, and keep the same speed of movement. It doesn't keep moving all the time. And I keep it for a long time because eye is focused. The same thing, it's not focused in your phones. It keeps moving all the time. And you're focusing on smaller objects, smaller letters, movies, running images. So this has a huge impact. It does not have a huge impact if it's just once in a while. But if you're using for more than 3 or 4 hours a day continuously, at different illumination, people off the light, it's most of the time, you do 2-3 hours of, we call it binge watching in the night. And what happens if you keep your light off? There's glare from here, and glare also has a huge impact on the way the eye accommodates. The accommodation is the most important factor here. That means the eye has to accommodate every time you are moving your space, moving this images, you're keeping it at a different distance and at different illumination. The big question is, how does this accommodation have an important role in our day-to-day life? You need accommodation to fuse an image. If you're looking at an object at a distance, you're trying to see with both the eyes, and you suddenly look at an image reading. From there to here, you have to fuse differently. So that means when at distance you don't fuse, you're seeing through both eyes, but your eyes are not accommodated. Accommodation means it moves inwards, and suddenly when you look at the image, you have to move inwards to fuse. If you don't have that fusion good, what happens is that you are not able to see image crystal clear. The image starts becoming blurred. You have that ghosting. The ghosting means you have a image with one more ghostly like an image to it. You see a second image which is ghostly there. You see a light, it becomes very glare. You see anything which is not very clear. You go to a doctor, he prescribes multiple glasses, you're not happy with it. You can't drive in the night. We've had many people who have accidents in the night because they just cannot face the light of the oncoming vehicles. So why does it happen? Is because of a constant stress of accommodation. Your objects are not fused well. Muscles are under stress. When the muscles are under stress, they don't give you the same good clarity what you should get in a healthy eye. This is the whole optics of the eye. And what happens if it keeps increasing? If it keeps increasing, it becomes worse and worse. Then you get stressed that something is not getting better and you're not able to get it treated. Even glasses don't help them. It's very common in children that people keep going to one doctor to the other, then they finally go to a neurologist, and many times they say, oh, nothing is working. My child is making something up because he wants to avoid studies. People have gone to psychiatrists, and the psychiatrists are treating them. So from a very simple issue, you have moved a child or a healthy person from being very good in everything, but having issues with some vague, we call it vague because it's very difficult to pick this up in common testing like this. So what do we need is when you go to a specialist, you tell him about the amount of hours you spend, what type of lighting you are working on with your phones, how much, in what posture do you see them, what distance do you speed them, how much of speed you change from different distance. All this has to be important because only then the doctor will think about, okay, there might be some issues with the accommodation. There are different tests to test accommodation. We test the amplitude of accommodation. We test if the eyes are having a poor fusion. We look at if there's a fusion is an issue. We have instruments which can help us to look at the fusion. And then based on that, along with your glasses, then we have to treat with exercise. We call the physiotherapy for the eyes. What happens if we don't treat them? This is going to be a very perpetual whirlpool. It just keeps increasing and increasing. So friends, restrict the amount of time you spend on smartphones. Don't at one step watch movies or binge movies, watching for more than an hour or two. This will have a huge impact over time. It's okay once in a while, it's fine. But more you do, it will impact the way your eye fuses. If you do it every day, more than 2 or 3 hours for a week, I can see that the amplitude of accommodation and everything drops down drastically. So it's very important for us is to advise you that phones are meant to be for a reason of taking calls, making some small text messages, but it's not meant to be where you can use it like a TV or your computers. It has a simple role, and I think we should make an attempt to use it for that role what is made for. Otherwise, I think we're going to have a lot of this vague complaints. We call it vague because it's very challenging for a doctor also to pick this up. until unless you do the depth of the testing, which will help us to understand what is happening. In my next small clip, I'm going to show you on an instrument what we pick up, what a patient actually is seeing if he's gone through this acute spasm of accommodation or poor accommodation, and how he actually sees what he's actually seeing. Let's come to this very interesting image from a machine called as eye trace, which is picked up from one of our patients who had extreme ghosting of images, and he was not able to understand what was happening, and it was kept increasing. This is in line with what I discussed previously in this talk about the loss of accommodative capacity, where accommodation and fusion just goes off. When you start having that, you get this kind of an image. If you can closely see this image out here, this is how a normal image should be from an E. If you're reading a letter, alphabet E, the alphabet E should be crisp and clear. But what happens is here, you can see that everything is like a ghosting. You can see that there's 2 or 3 images. The classic thing is patient kept telling that I see some 3-4 images of this, and this is one thing which makes us understand that there is something happening here. And these instruments are the ones, one of the many we pick up, to understand what is happening. And now if this person reduces the amount of usage, we give some exercise, we use some accommodative relaxation techniques, then probably this whole of this ghosting will narrow it and become something like this. And this is what is an ideal one. So just to give an insight about how we actually look for things which is not commonly experienced and not commonly understood by both by the patient and as doctors also. Thank you.